Echoes from the Valley, telling the African story.
Pandemic is a very serious issue. And unfortunately, because of the pattern of this pandemic, a lot of people are not taking it serious. A disease where you have majority suffering from it may be asymptomatic. They may not have any symptoms, they may not be sick, they can move from one place to the other. It calls to question their trust in the fact that are they actually suffering from this disease, simply because they don't have symptoms. However, the little percentage that actually shows symptoms or actually die from it shows us that this problem is very serious. If you go away from the city center into the rural areas, into the local areas, you find out that nobody is complying with the COVID protocols, which seeks to prevent unnecessary spread of this disease condition. And simply because of ignorance, simply because a lot of people don't believe in it. In fact, some will tell you it is simply malaria. This is not so. It's a viral disease that may present with symptoms of malaria, and it's worse for people who have underlying ailments, diabetics, hypertension, or cancer treatment, or overage. These are situations where the infections of COVID can be very dangerous to the society. So we have a lot of challenge trying to convince the public that this disease is real.
Echoes from the Valley, telling the African story.
This disbelief is not only among the poor communities, it's not only among the lower cadre of people, even people at higher level, politicians, directors in civil service, captains of industry. Some of them don't believe in this reality. But the truth of the matter, as I said earlier on, is whether you believe or you don't believe COVID is real. Now, I discovered that the non-believer majority of Nigerians is the fact that they have not seen the reality. There was a friend of mine, actually a friend to a friend of mine, who is very nonchalant about COVID. And my friend told me that he has a very good friend, but this man does not believe about anything about COVID. He's always violating most of the protocols and all of that. So I said, okay, can you arrange a meeting between me and the man? He said, yes. And they came to my office here, and I took them to one of our isolation centers, this day dome. What the man saw, there and then, he said, God, that he believes that people are lying. I said, they are there. Most isolation centers are filled to capacity. So much so that the government now even decided that some of these cases are going to be managed at home. The symptoms are classical. You have a serious cough, you have difficulty in breathing, you run temperature, you have all manners of symptoms that are very specific and observable. So how else will you say you don't believe? So, but the other man will say, Ghanaian Fiji. You see, if you see something practically, it's better and much more believable than when you just hear it. So by the time I took that man to that center, man, he became an advocate of COVID-19 is real. And I'm sure a lot of people are like that. So the fact that you are not feeling a direct symptoms or a direct consequence of this disease does not take away the fact that that disease is real. These developed countries that you see, where a lot of cases are being seen and a lot of deaths are occurring, do you think globally everybody will be scamming themselves? Obviously, there might be associated scam, associated corruption, associated a lot of things with the management of COVID. But that does not take away the fact that COVID is real. And so, like any other endeavor of human, there might be all forms of distractions from the management. But that does not take away the fact that COVID-19 is a real disease. It's not just real, it's killing people. It's destroying economy. And it's causing a lot of slowdown for so many countries. ICT capability or digital capability of many African countries is such that it does not capture real-time life and death, birth and death. Okay? What I mean by that is that for so many communities, even in Nigeria, the registration of birth and death is not yet seriously digitized. You still have to physically go to a particular center to begin to register birth and death. And I'm even aware that more than 90% of deaths are not actually being registered officially. So this is a baseline habit. What that means consequently is that if somebody dies in a particular community or an environment, especially among the Muslims, the first thing you do is within few hours that person is buried. Nobody begins to go and look for National Population Commission to begin to register the death or something. The chances of registering that death increases if the person dies in a government hospital or a very structured private hospital. So if that's not in place, you will see that a lot of deaths will go unnoticed. And some of those deaths may not even have the opportunity of actually ascertaining the cause of death. You know, because if somebody dies at home, many people will not take to hospital. They will just bury at home immediately. So you won't be able to find out the cause of the death, and you will not even record that death. So I'm sure these are the areas where federal government is also working very hard to ensure that all deaths and all births are adequately captured. Then, secondly, the challenges that a lot of people are facing with the label of a patient as COVID is also very important. Because like government has also ruled out a burial protocol for COVID patients, which brings a lot of issues, like you cannot touch, you have to wear PPE, there are a lot of protocols on that. So many people don't like that. So, for example, a Muslim man was telling me that, look, if you are declared that you died of COVID, then the chances of the bath that Muslims give to their dead before they are buried, the wash, you may not be able to have that. So that are some of the wrong perception why a lot of people may not want to record the fact that somebody died of COVID or died of any disease at all. Now, if you look at that alone, and the fact that naturally Africa in general has this kind of pattern of arrangement in our locality, so it will be very difficult, if not impossible, to have an accurate data of death, total death, not to talk of death associated with COVID disease.
In Nigeria, we are still limited to the Nigerian Center for Disease Control and maybe one or two organizations. So until we get to the stage where these testings are licensed to private labs and it is done at a very cheaper cost, that people who are actually symptomatic or people who feel like they need to know their status can actually walk down to these places, that is only when we can say we've made progress with testings. At the beginning, you will realize that it's probably Lagos, Abuja, and maybe one or two other states that can test. Every other pull their samples to the center. But as I speak with you now, even in Abuja here alone, we have more than 10 centers where you can do COVID testing. In that regard, to ease off the congestion in testing, federal government had approved the participation of private labs. So with the coming of the private laboratories, you see that the pressure on testing is a little bit down.
The vaccine is actually real, and Nigeria is expecting their own consignments. It was supposed to actually come in this month, but I understand issues that have to do with supply and all that caused the delay. That's actually why it shifted to next month.
The principle of distribution of vaccine will be based on the degree of vulnerability by the different groups in the society. By that, it's meant that this COVID, like I said earlier on, has affiliation for people who are elderly, people who have an underlying ailment, diabetes, hypertension, and all of that, and then the frontline workers. These are the first set of people that are greatly at risk of contracting the COVID-19. And so a reasonable society or a reasonable country, first of all, we've prioritized those ones as the first level to receive the vaccine. So if you are at a particular age and above, if you are diabetic, if you are hypertensive, or if you are a frontline worker, or if you are an essential worker that has very regular contact with the public, this would be the first line. Okay, and then from that level of description of the first line, then you stratify the remainder of the society once you can capture the majority of those groups.
Echoes from the Valley, telling the African story.
The amount of vaccine you can order cannot, you can afford at a particular point in time. You cannot equate it to, say, one of those top 5 economic giants who can afford to order as many vaccines as possible and pay up, and not go through any credit facility. Like, I understand we're also using World Bank to facilitate ours. So you don't expect any country, as far as this sub-Saharan part of the world is concerned, to compete with those economic giants out there.
There is even another challenge that you don't even know, and that is accessing this vaccine. Some countries have booked millions of doses ahead. And so even if you have the money now, you may not even be able to get that vaccine as easy as you think, because many countries have booked several doses from the manufacturers. And so we don't even have resources available, not to talk of booking for these vaccines. So that's another challenge that you look at. But the present reality is that, can we fund this vaccine the way they will? The answer is no.
I think we should go back to what we started initially when COVID first came out. Enforce those preventive measures. Face mask. Well, at the time the prices were high up, but now I think 100 naira can get you one. So we enforce compulsory wearing of this face mask at workplaces, in schools, because schools have resumed, in hospitals. Make water available, because, to be honest, some communities do not have water, even here in the FCT. So if you want to slaughter such people for not washing hands properly, you will just be so unfair to them. Make water available so that people can wash hands at every place. And then medical education, very important, because people need to be educated on what COVID is, because as we speak, about 20% of Nigeria's population do not believe COVID exists. So we need to educate these people that there is COVID. COVID is real. COVID is killing people. It doesn't kill itself, but people die of complications from COVID. So they need to be educated. Government has to do enough, make these things available. And if there used to be medical education carried out by community health workers. Where has that system gone to? Those things need to be reactivated so that at various communities, these people can be gathered together in groups and taught what COVID is all about. I think it will go a long way to help.
Federal government, for example, you see that they are footing the bill for all the testing for COVID. That's one support. So if you are testing for COVID, except for those traveling abroad, you are not expected to pay. Federal government is supporting that. And you also see the frequency at which the PTF meets to review all the findings, on COVID. They will review the number of cases seen, the challenges, and the way forward very frequently. Now, they have just gone beyond just review to ensure that the federal government introduce a COVID-19 protocol. This protocol describes the way and manner you prevent yourself from getting this COVID-19. And they ensure that the protocol is strictly adhered to. For example, if you enter any facility, you must go in with your face mask, you must wash your hand, you must sanitize your hand. And you must also maintain social distance of at least 2 meters. These are some of the protocols they have set. And also, they prevent gatherings of people not more than 50. And even in such gathering, everybody must wear face mask and, sanitize as appropriate. Now, if all of that is being placed as protocol and people are not following it, federal government has gone ahead to introduce some measures that are legally binding on the citizen to ensure that they comply with these protocols. And consequently, there are task force or task forces all over the country that goes around, different areas of the community to ensure that this COVID protocol is strictly adhered to. Recently, you are aware of the case of Wuse Market that was supposed to be shut down because of failure to comply. You are aware of many nightclubs, 2 recently around Karo area, are being shut down because of this failure to comply with COVID protocol. A lot of people were arraigned before a mobile court for disobeying COVID protocol. And they are going from institution to institution now to see whether, for example, in this our place, we have our COVID protocol. You could see that a lot of people are not, at work. Now, the federal government decided to say staff from level 12 and below should stay home. And when they come to work, some of them should alternate so that everybody don't come at the same time. That also encourages the safe distance, maintenance approach. So you see that government is doing a lot in trying to ensure that, COVID is not unnecessarily spread. Again, we are aware that most of the initial spread of this disease is through the airport, through the international travel. So they've done a lot to ensure that anybody coming to the country must have a COVID test done in the country of their departure. And so when they arrive in Nigeria, maybe about 7 days or thereabout, they also go and do another COVID test so that we'll be sure that we are not importing COVID unnecessarily into the country. So I'm sure these are some of the measures that the government has put in place to ensure that we prevent unnecessary spread of COVID-19 disease.
Echoes from the Valley, telling the African story.
This pandemic should teach us a lot of lessons. It should teach us that now it's all the mistakes we made earlier, playing with our economy, politics, all kinds of social issues that we'll be having, that has made our economies all across sub-Saharan Africa. I'm not going to limit to Nigeria. That has made us not to grow. I think this should be a wake-up call. A lot of our leaders have also come down with COVID and recovered. So I think we should all be turned born again, if there's anything like that. Turned born again, know that it's real. And this should be a wake-up call for us to go back to the drawing board, look at our economy again. Let us stop the politics we play with our economies. Let us see how we can build our economy now, so that in case there will be such kind of sicknesses again, it won't hit us as bad as it did. You can afford to go on lockdown and your economy will not collapse. A lot of countries there, because they have a very buoyant economy, they can afford to go on lockdown for months to stem the sickness, and the economy will still not collapse. But Nigeria tried it for 2 weeks. You and I know the effect. We entered into recession. So it tells us that a lot needs to be done going forward. We need to now start looking at the long term. What lessons have we learned from COVID-19? Yes, we didn't die as speculated. The population was not decimated. But how about the economy? What happened to the economy when we tried to do what others did? Now, because this is COVID-19, this is not the first pandemic. History is replete with a lot of pandemics. There is one of 1920, there's one that happened earlier before that. Now, it tells you that this is not the end. There will still be, even if we, by God's grace, we're able to get the vaccines and we're able to contain it finally. What makes us think that in the next century that is about to come, there will be no more, there won't be another pandemic. And of course, that will be followed up by a lockdown. So it tells us that as we are busy trying to sort out this particular issue we are having, the leadership of all these African nations should sit up and, as much as possible, start planning from now henceforth. What do we do? Let's leave out politics. Let's leave out all those divisive tendencies that actually keep us where we are. Let us actually look for professionals, technocrats that can take our economies to where it should be. So that when you have a very buoyant, fat economy, let the pandemic come, let the lockdown come, we will still survive it.
Echoes from the Valley, telling the African story.
COVID is such a disease that it can deceive you, can deceive you. If, for example, you are told that you are COVID positive and they took you to isolation, and from the day one of your isolation to the end, you did not show any symptoms. So if you are not, medically competent, you'll be asking yourself, why have these people kept me for this long? But even though you are not showing symptoms, you are a risk to another person in the community. You can transmit that same thing to another person who will show a much more worse symptom and can even die from it. So that is how tricky it is. So in a reasonable society, you must be very careful that you manage this situation carefully and don't expose the general population to the ignorance of somebody else. Prevention is better than cure. The basic protocol to prevent COVID is simple, and the benefits are overwhelming than the risk. Now, what are the basic principles? Wash your hand, use a face mask, sanitize your hand, social distancing, minimum. It costs you nothing, you are not going to lose anything, but you are going to prevent yourself from an unnecessary fatal risk should it happen to you.
Echoes from the Valley, telling the African story.